We took immediate actions upon forming office 18 months ago. We continued to, I think in the last 3 months, I made 4 major announcements about expanded addiction treatment services in Alberta. So that's more than immediate. We've already been acting with unprecedented ambition to support people coping. Our government came to office with a commitment to launch an emergency plan to address addiction and opioid overdoses in particular, with the largest ever investment in Alberta history in addressing mental health and addictions. We appointed an associate minister for mental health and addictions. We've announced massive taxpayer investments in providing much greater access to detox treatment and long-term recovery programs for people struggling with addictions. We've made multiple announcements about new holistic therapeutic communities that we are building across the province, and partly in partnership with First Nations communities like the Kenney in southern Alberta. And we've begun the quarterly reports, one of which you just referred to. The opioid overdose deaths is a huge tragedy. Our heart goes out to all of the families and loved ones of those who are affected, and everybody who's struggling to cope with addictions. And I'll be having something more to say about this in the next week or so, as we address the more recent surge in cases. It's clear from people who work in the addictions services that the situation has deteriorated across the country. It's not just in Alberta. As you know, the highest spike in opioid deaths recently was in British Columbia. And so if drug injection sites were the solution, we wouldn't see the highest increase in addiction deaths in the place where there are the most drug injection sites. What we've seen across the country is that people coping with addictions have had an increase in money available through CERB, $2,000 a month. We've seen addiction workers across the country report that this unfortunately has resulted in increased drug consumption for people coping with addiction. I've asked the federal government to address that issue, to look at that very closely. We also saw in the very early days of COVID an interruption in treatment services for people seeking recovery. We worked, unfortunately, at the very beginning of the COVID restrictions in Alberta. Some of those restrictions meant that some treatment centers suspended operations or had to reduce the number of people they could treat. That interruption probably had a very negative impact on people who were seeking treatment. And so we worked very closely with Dr. Hinshaw to make an exception for treatment centers to be designated as essential services. But certainly that interruption very early on, plus the stress generally, plus the additional funds available to people coping with addiction, collectively have had a devastating impact. We don't believe that the government giving people who are coping with addictions free drugs is a solution to the problem of drug addiction.